Quite the weekend on all sorts of levels, capped off by the president and his speech last night. We'll talk about it. Welcome into my state of mind. I am Dan York. You know who you are. Let's get going on this Monday evening. It's a weird day today. You know, I got on the radio weekdays noon to 3 on WPRO, and we talked a little bit about the president's presentation last night, and nobody got it. You know what I mean? I don't blame him for waiting till Sunday night to admit that there was terrorism involved in the San Bernardino shootings. It's just that nobody got what he was saying, other than it was a lot of the retread kind of stuff that he said. It's almost as if he feels like he's holding on. You know what I mean? I got 13 months, I can get out of here. We'll talk a little bit about that. And I've got a really terrific guest from Brown and Rhode Island Hospital who specializes in understanding how we can prevent hurting ourselves, if that makes any sense. I think that's what I understand from her expertise, but she's phenomenal, and she'll explain all that, because I really wanted to see if we could get into some of this gun control conversation, but it's just hang in there. I think at the end of the show you'll go, wow, that was really interesting. So let's go to the rundown. It's a small rundown tonight because my guest is interesting, and I'm just, well, I was going to talk about Kevin's Patriots. It's only two. He already told me we don't need to talk about that. And if I talk about my Giants, I'm not going to make the end of the show. That's how upset I am with what's going on. How you lose 6 games in the way they have done. They've lost 7, but 6 of them, there's no excuse. This one was incredible. The headline Saturday night. Now, all disclosure, you know, I am the public address announcer at the Ryan Center for the URI games. This was a classic, some would say game of the decade, perhaps the century. It was just unbelievable. Whoever had the ball last was going to win that ball game, and unfortunately for URI fans, PC had the ball last. Fortunate for Friar fans, PC had the ball last. And a tip at the buzzer by Ben Bentel won the ball game. Coach Cooley had some commentary.
I thought we withstood a rush to the glass. I thought we were tough when we needed to be. I thought we had some timely shots. We said in the huddle, whoever has the ball last will probably win. That's
what I said. Did he say that first, or did I say that first? Coach Hurley was devastated.
Heartbreaking loss. Played so well, played so hard.
You know, again, can I just say this? It's not often that I start the conversation on a sports issue here tonight, but I just wanted to say something. Coach Cooley was very gracious in his post-game press conference and pointed something out that I thought ought to be repointed out. And he said, you know what? If this building, which he said was the toughest atmosphere he'd ever played in, think about that now. Think about that. If this building, meaning the Ryan Center, was like this every night, it'd be a hard place for anybody to win against URI. And the truth of the matter is that the Dunkin' Donuts Center, the home for the Friars, you know, most nights gets 8, 9, 10, 12,000 people and sometimes sell out. And there's a built-in constituency and geography for the Dunk in the Providence, you know, down city, right? The Ryan Center's a longer ride, and it's a little more problematic for people. But let me tell you something. For you PC fans, congratulations on everything you got going on. This is going to be a hell of a year. They're now ranked 18th, and I think they're going to go to the show and make a lot of noise. URI is good enough to do the same, but they need the emotional, psychological help. Now, you may not think this is a big deal and important enough, but let me tell you something. If you fill the Ryan Center, they will win, and they will go to the big show, to the tournament. If you don't fill the Ryan Center, you know, studies show a crowd like that's worth 6 or 8 points. PC's a better team than URI right now, and URI almost clipped them. So look, you alumni and fans of URI, you show up, you help your team. You don't show up, you don't. Simple as that. You know what's really simple? The solution for the firefighter nonsense in the city of Providence, but for some reason the mayor doesn't seem to get it. The headline on this one is a dandy. Right now they're getting after each other, and threats of even prosecution. Roll tape.
The Providence Fire Department is back to full staffing tonight after being down the minimum number of firefighters required to be on duty since Saturday. This morning, 91 firefighters showed up to work in Providence, down by 3 from the required 94. But an improvement since Saturday night, when city officials say only 83 were on duty after a number of firefighters called in sick. And Public Safety Commissioner Stephen Perry says they couldn't reach off-duty firefighters to call them into work.
It's those who were off duty that refused to come in and fill those vacancies that put us in this predicament.
City spokesperson Evan England says the city is investigating communications between those firefighters who didn't respond and would consider prosecuting them. The Firefighters Union president says plenty of firefighters were willing to work during those understaffed shifts, but were sent home because they had worked too many hours in a row, a rule that is rarely enforced. For Sunday's day shift, Paul Dowdy said 3 fire engines were operating with 1 less person than required, including Engine 3, which Eyewitness News saw responding to a call just before 5. The staffing debacle is part of an ongoing legal and political dispute between the firefighters and Mayor Jorge Elorza over proposed platoon changes.
I think Steph got it pretty good, Steph Machado there. Here, excuse me. The too much working rule is called the 38-hour rule. They can't work more than 38 hours, but they never enforce the rules. Let me ask a question. Why would the city of Providence enforce a rule that they never enforce while they can't get the guys in? They can't get the guys in, but they enforce the rule that they never enforce. That creates the lesser manpower. I feel like this is kind of like watching a spy movie. It's like international relations, who can sabotage who more. And now you're talking about arresting firefighters who you couldn't find on Saturday night? This is not leadership. This is embarrassing behavior on the part of the mayor and his team, which is obviously following the mayor's lead for, I hope that Steve Perry's crossing his fingers and his toes on this one. Get them back into a room, settle this dispute, pay them appropriately for a 3-platoon system, be done with it, because you're going to get your head handed to you in the state Supreme Court, and that's going to bankrupt the city and everybody loses. Knock it off, Mayor. Dare I say, grow up? The president spoke last night, and he's got everyone kind of scratching their heads, like I said at the top of the show. The headline from the New York Times, "We'll overcome it," and it feels hollow to most people. There's no new initiative to suggest we will or how. Here's a wrap-up.
Good evening.
President Obama tried to assure anxious Americans that the government will do everything it can to stop terrorist attacks from people inspired by ISIS.
The threat from terrorism is real, but we will overcome it. We will destroy ISIL and any other organization that tries to harm us.
But critics attacked the president, saying he didn't lay out any new strategies to protect America or defeat ISIS.
We're at war with Islamic radical terrorism, and that, as such, we need to have a strategy, and he needed to persuade people that our fears will subside when we are engaged actively in the destruction of ISIS.
We cannot turn against one another by letting this fight be defined as a war between America and Islam.
ISIS has drawn in recruits by claiming America is fighting Islam, and a friend of Syed Farouk, the shooter in San Bernardino, told CBS This Morning that Farouk didn't like living in America.
He told me him paying taxes was helping the United States support basically the war on Islam, the war on Muslims.
Still, a majority of Americans say the U.S. needs to do more to take on terrorists, with a new poll showing 68% say the U.S. military is not aggressive enough in the battle against ISIS.
Which is a definite turn. All you need is a terrorist attack like we had in California to create that turn. You know, the president was very tepid in holding accountable the Muslim American community and the Muslim community in the whole free world and in the Middle East. I'm not suggesting blame is in order here, but I would like to, and I'm encouraging those of you who are Muslim Americans, contact us here, come on the show, explain what's happening in the mosques, talk to us about what you're worried about, what you're talking about, because we need, you know, the CARE organization, the Council for American Islamic Relations, whatever, is not the organization that's solving anything at this point. Do a little research on them. We need to hear more from Muslim Americans, and he needs to demand more accountability, and proper rhetoric from Muslim Americans. It's only one component, but it's important. In the meantime, it's all about the weapons, right? Roll that.
Here at home, we have to work together to address the challenge. There are several steps that Congress should take right away. To begin with, Congress should act to make sure no one on a no-fly list is able to buy a gun. What could possibly be the argument for allowing a terrorist suspect to buy a semi-automatic weapon? This is a matter of national security. We also need to make it harder for people to buy powerful assault weapons, like the ones that were used in San Bernardino. I know there are some who reject any gun safety measures, but the fact is that our intelligence and law enforcement agencies, no matter how effective they are, cannot identify every would-be mass shooter, whether that individual is motivated by ISIL or some other hateful ideology. What we can do, and must do, is make it harder for them to kill.
Dr. Megan Ranney is from Brown and Rhode Island Hospital, and it's an emergency doc, right? Mm-hmm. But you've done a lot of research on a lot of things. And you're shaking your head a lot as you watch the president, nodding. Maybe a couple of these, but a couple of these. We welcome you to the broadcast.
Thank you. I'm honored to be here.
Thanks for coming. What is your take on the gun risk?
It's a great question. So I'm an emergency physician, right? So I work at our state's only level 1 trauma center. On average, we see a victim of gun violence about every other day, right? And the majority of those, as much as I, like everyone else in this country, is scared about terrorism, the majority of those, right, are not mass shootings or are not terrorism. That on average in this country, we see around 30,000 deaths from gun violence a year. That's as many as we see from car crashes. So you're just as likely to die from gun violence, from a firearm injury, as you are to die in a car crash. And people don't really talk about it that way, right?
So when you listen to the always percolating conversations whenever we have an attack here, and God, I hope this is not a bi-weekly event, or bi-monthly or whatever. I mean, my goodness, no one knows what's next, and that's what's got everybody upset.
Oh, it's horrifying.
It's horrifying. I mean, you're a mom. You get it. You got 2 little kids. I mean, you're not just a doctor. You're a real person.
Thanks.
I say that. Yeah, well,
tongue in cheek.
Well, yeah, doctors are just in society. Up here, we forget that you're just real human beings. You've got the same neuroses that everybody else does about certain things.
Maybe more.
Are you so how do you process this gun conversation with the terrorist thing real quick, and then we'll talk more about some of the things you're really, really researched on.
Yeah, so the terrorism thing is interesting, right? We actually know, and this is the one thing that I think that Obama got right last night, is we have a lot of trouble identifying right now who is going to be a terrorist. That they're doing a better and better job, it seems, of hiding and surprising us. And so to me the question becomes, well, how do we keep them from killing us, right? And the thing is...
You know the answer to that?
No, I wish I did. I am not a forensic...
I was going to take a break and say, well, that answer is coming right back.
Yeah,
in just
no.
a couple minutes.
I wish I were a forensic psychologist. I was saying before, my uncle was a Secret Service agent, and if he knew the answer, he would be thrilled too. I think there are a lot of different people that are trying to figure out. That's not what I do. I don't treat terrorists in the emergency department for the most part, knock on wood. But I do treat a lot of people that are hurting themselves and others.
Are there better questions we should be asking ourselves?
So I think so. I think that...
Good. Stop.
Yeah, okay.
When we come back, there are better questions we should be asking ourselves. We'll be right back.
There is an obvious common sense consensus, John, in this country that guns should not be falling into the hands of people who should not be having them. And obviously that goes without saying. I don't think it's very hard to understand that terrorists or potential terrorists should not have guns.
Yeah, well, no kidding, Bernie. So, Doc, what questions should we be asking ourselves at this point?
So I think there's a few things. So obviously we all want to be safe, right? Nobody wakes up in the morning and says, hey, I want to get hurt today. So the question is, how do we do it? And that's where I think we can use parallels from other areas. So over the past 50 years, we've decreased the rate of car crash deaths by 90%. We've decreased the rate of cigarette smoking by 50%. We've decreased the number of pediatric poisonings, like, you know, little kids opening up their mom's medicine bottle and getting into it, by 75%. So we know how to prevent injuries and death, but we're not doing it for guns. So how do you do it? So what are the questions? So there's this public health approach. When I say public health, people go, oh my God, you're talking about vaccines, you're talking about infectious disease. Public health applies to injuries too. So the first step is you look at who gets hurt and why. And we know a little bit about that, but not a ton. Then you look at, well, what can we do to change those risk factors for getting hurt? So with cars, we figured out that driving drunk put you at a higher risk of getting hurt yourself or hurting someone else. We figured out that the way that cars were designed put people at a higher risk of dying. So we created, you know, those crumple zones and things like that. We don't know that for guns. And then you do kind of the public health approach. You say, well, let's try this. Let's try this intervention and see if it works. And if it doesn't work, let's go back to the drawing board. So instead of making decisions based on ideology or, you know, strongly held beliefs, you're making them based on facts, which would be nice. And the problem is with guns, we don't have a ton of facts right now because since 1996, the CDC has been banned in doing research on firearm safety and firearm injury prevention. Obama, in theory, lifted that ban in 2013 after the Newtown shootings. But unfortunately, because of political pressures, there really hasn't been an appropriation of money to do that research that we really need.
And so what would that, if you could write your ticket, what would that research look like?
It's a great question. So there's a few things. So the first thing is what can we do, you know, do these, if we change availability of guns to people who have risk factors, does it change the risk of illness? And this is a place where, for instance, you could partner with, and I think you must partner with folks, say, for example, that own gun stores, right? If you're someone who owns a gun store, you don't want to be selling a gun to somebody who's going to go out and kill themselves or kill someone else, right? So what can we do to make life easier for them so that they don't have that kind of risk for themselves? You could do research to say, if we get someone in the emergency department who we think is high risk, what could we do to keep them from going out and killing themselves or killing someone else? We know there's tons of studies that you can do relatively cheaply showing that if you're in the emergency department because of a violent injury, you have 10 to 20 times the risk of having another violent injury or a firearm injury. There are studies showing that firearm suicide attempts are tremendously fatal, especially among kids. So this is a statistic with little kids that always gets me. But so of youth, kind of folks under age 18 to 21 who commit suicide, 80% of them who do it with a firearm get that firearm from a family member, you know, find it in their house unlocked. So what can we do to prevent that? Mm-hmm. So there are a lot of really great studies that we could do that have, and I know I have a number of family members who own guns and I have these discussions with them. And they go, you know, it's really important to me to keep my gun. And it's not about taking away guns any more than it was about taking away cars, right? We've made car crashes so much less fatal despite the fact that we've increased the number of cars on the road.
It's fascinating. How do you create this conversation inside a knee-jerk political environment that as soon as you say guns, people run from one side of the room to the other side of the room with this whole vast place in the middle that most people, I think, live in?
I hope so.
The decision makers and political people go this way and this way. NRA goes this way, depending on your side of the television, left or right. They go right. Others go this way. And most of us are sitting here in the middle going, hey, there's a really smart doctor on Dan York's show the other night. How do we get her involved? How do we get that question involved? How do we get that research involved? Because she's not saying take the guns off the street. Well,
maybe for some people, for a very few, right? So for a very few. So for maybe people who have a history of domestic violence, things like that.
Right. Well, we have some. We
have some laws.
We have laws
right.
in that category. But are you talking about? Do you project that this kind of research would end up in new legislation or new behavior?
That's a great question.
Without the need for legislation.
So I think that so when you look at kind of injury prevention and those other things that I talked about, car crashes, childhood poisoning, smoking, you can do it in a lot of different ways. So you can do it through education and behavior change, and that is critical and really important. So with cars, We've got driver's license. You have to take a class before you get licensed. We've changed the engineering of cars, right? There's those crumple zones on the front. There's seatbelts. There are airbags. But there's also some things in injury prevention that sometimes do need laws or economic incentives. So like for insurance, right? You get a safe driver credit. If you're not in a car crash, you pay less in your insurance.
Hold that thought,
yeah.
because I don't know how, I'm not sure how this translates to the criminals. We'll be right back. Stay with us.
What we need to be focused on here are two issues. Taking criminals who commit crimes with handguns and putting them in jail. And we have to work on our mental health system in this country to give doctors and caregivers greater latitude to involuntarily commit folks who have mental health issues and who don't want to take their medication and help themselves.
Dr. Ranney is from Brown in the ER at Rhode Island Hospital. In our last segment, I feel like you were giving, you were talking about research to help consumers and people who legally obtain guns be even safer with them, but perhaps we were veering off a little bit from the other tiers of conversation that have us so worried. That is terrorism, which you profess no expertise in, and I appreciate your self-actualization there, because everyone thinks they are and they're not. I know I'm not. And then secondly, the criminal element. So, who's going to benefit from the how to be safe research in the criminal community using guns in an illicit fashion? Have you thought of it? Is there research that you can apply your expertise to that actually permeates or penetrates the criminal gun use element?
So so there's a couple things. So first, I'm going to say right off the bat, so there are 2 times as many gun deaths from suicide as from homicide. So twice as many gun deaths. Yep. So I think that talking about criminals is important, but if we really want to deal with stuff, we need to talk about suicide.
Holy cow.
Yeah, isn't that great? Nobody ever talks about it. We all think about guns as being terrorism or as being gang violence, but you're way more likely to die from suicide. Which again, there's stuff that we can do, and that's where it's talking to responsible gun owners.
Well, we've been talking about the mental health balance with gun acquisition, period. So I'm sure that the suicidal numbers are impacted by clearly a mental health challenge. I mean, people are they're depressed, they're anxious, they're in a place where they're in a toilet swirling they can't get out of. So, but there's the one piece of research that nobody seems to be able to get is how to determine somebody's mental health before they get access to a gun, whether it is to use it on somebody else or themselves.
Right. So that is the million-dollar question that will honestly require at least $1 million to answer. Yeah, and there's just not the money there, a lot more than that, but there's honestly not the money for it right now. There's a great study going on that's partly being done at Brown, looking at, there are 2 actually, looking at emergency department patients, trying to see if we can figure out predictors of suicide. So if someone comes into the emergency department, what are the chances that they're going to go on and hurt themselves? How do we figure that out? It's a very imprecise science right now.
A lot of pressure on psychologists, psychiatrists, and you people who are right in the, I mean, how do you make that call?
Oh my gosh, it's so tough, but that's what we do our training for. I mean, we try to do it with empathy and doing the right thing for our patients. It's very difficult, and part of the problem is there's not beds available. So if I have someone in the emergency department who's in a crisis, getting them in to an inpatient bed, getting them in to see someone quickly is incredibly challenging.
You can for a split spleen, but you certainly can if they're stressed.
Right.
Yeah, it's a big difference.
Right? And then if they own a gun, I know that that's one of the highest risk factors for them hurting themselves. So if you try and commit suicide with a gun, you have 80% likelihood you're going to die. If you try and commit suicide by any other means, it's like around 10% likelihood that you're going to die.
All right. Will you come on the radio with me soon in the next week or two?
Absolutely.
Talk more about this.
Thrilled.
The conversation went to another place that surprised us. We'll be right back. Stay with us. We'll get Dr. Ranney on the radio soon. I'll let you know when that happens. That conversation turned into a place that might have made you feel better on one end and really crummy on the other end, don't you think? Paul Dowdy from the Firefighter Union will be back here for an update on the acrimony between he and the city, and I'll see you on the radio tomorrow at noon, too. Bye.